Now, the Komfo Teaching Hospital is recording an upsurge of COVID-19 cases among children. In the last 10 days, the facility has recorded 9 child cases, including an 11-year-old baby, an 11-year-old. Well, head of the Child Health Directorate, Professor Samson Enchi, says the situation is taking a toll on the facility as management struggles to create space for children diagnosed with COVID-19 and other diseases.
The Komfo Teaching Hospital is the only pediatric referral facility in the northern sector of the country. Like other health facilities, the hospital is overwhelmed by the number of COVID-19 cases involving children. At least 9 cases have been recorded in the last 10 days. Head of the Child Health Directorate, Professor Samson Enchi, says the situation has put a strain on the hospital.
We are having a huge surge in COVID-positive cases. The disease initially, children were said to be spared. We have 14 the whole of last year. But this year, just in a space of 10 days, we got 9 positive cases, children. And our HIU, remember, our main pediatric HIU is 3 bed. That is full. MBU is 1 bed. That is full. And so it's so happened that some 2 other positive, other 2 are well, they've been discharged. 1 person died, have been discharged. And so we had another 2, but we had to keep them at the holding area. The COVID strain that we are having now is really also affecting children, seriously, because in the first of 10 days, less than 2 weeks, we are getting 9 cases. We don't know where we're going to go. And we are already full. And so that is what we are saying, that everybody must help.
Management says the hospital is overstretched and it is in dire need of space. Professor Enchi says the facility can no longer admit pediatric cases. He says there are ongoing talks with the Regional Health Directorate to create a treatment center for children with COVID-19.
As it is now, we are not in the position even to bring new cases. I don't mean COVID. Anybody who is sick, if you come here, we will just drag you in front, rubbing an ambulance that you came with. If there's something we need to do for you, we can do to stabilize you, then we send you back. Because our wards are full, we are exploring the possibility of getting treatment center for children. As far as I'm concerned, we haven't got a place for children. And just Monday, we were in talks with the medical director to actually talk with them. I think he also had discussion with the regional health directory to see if they can create space for children who are stable, COVID positive who are stable, so that we can move some of them there, so that we can get space.
Medical Director of the Komfo Teaching Hospital, Professor Bafo Kofi Poku, says out of 504 samples taken, 251, representing 49.8%, returned positive.
At the end of yesterday, which is the 26th day of January, we have tested 504 patients, out of which 251 are positive, 49.8%. Almost 50% of all patients who have come here and have been tested have been found to be positive. So it is the duty of us, and together with you, the press, to drum home to the public about the need for us to take the preventive measures seriously.
Meanwhile, management has denied allegations of neglect and lapses in its COVID-19 management. Some caregivers at the Child Health Directorate have accused management of putting their lives at risk as suspected COVID-19 cases are managed alongside other patients. But at a press briefing to respond to the allegations, management denied the allegations. From Kumasi, for Joy News, Ohiminteria reporting.
And to have an 11-day-old baby contracts the COVID-19 virus, I know a lot of parents will be panicking. On the AM show after the news, throughout the course of our show, we will have conversations on that, try and get a pediatrician to speak to us on the back of children now beginning to also record higher numbers with COVID-19.